And right now at 5:30, President Biden will likely announce tonight that all federal employees and contractors must be vaccinated or regularly tested. This as governments and businesses scramble to change course on mask guidance.
The country is dealing with a dramatic surge in COVID-19 cases that hasn't stopped the growing division over how to put the pandemic behind us. The CDC's new guidelines call for everyone, regardless of vaccination status, to wear masks indoors. That's in areas of high transmission and in all schools. The CDC also says today that it updated its guidance based on new data about the Delta variant.
With prior variants, when people had these rare breakthrough infections, we didn't see the capacity of them to spread the virus to others. But with the Delta variant, we now see in our outbreak investigations that have been occurring over the last couple of weeks, in those outbreak investigations, we have been seeing that if you happen to have one of those breakthrough infections, that you can actually now pass it to somebody else.
Walensky also stressed that vaccines are working by preventing greater levels of hospitalization and death.
And new data shows that the emerging Delta variant is 225 times more contagious. News 8's medical reporter Dr. Mary Gillis spoke with an Indy-based doctor about what this means for Hoosiers. Mary.
Not only is the Delta variant more contagious, breakthrough cases are rising, making it possible for a person to get infected with the coronavirus and spread it to others. Breakthroughs are when people who are fully vaccinated yet still get infected with COVID-19. The reversal is tiring and frustrating. However, I spoke with Dr. Christopher Doering, Vice President of Medical Affairs at Franciscan Health, who says the CDC's decision was the right one.
This strain, it is more contagious. It does seem to be causing more breakthrough infections, whether they're symptomatic or not. And so, again, I think that's where the CDC is now saying the risk is sufficiently high that it justifies being masked so you don't inadvertently spread the virus without realizing it.
Some tough decisions are going to have to be made here in Indiana at the local, regional, and state level, he adds. Health commissioners are going to have to weigh the CDC guidance with what's happening on the ground. Currently, Marion County is in the yellow advisory level. Doering also says there is overwhelming evidence that this virus is here to stay in some form, but if we continue to maintain broad levels of protection, including here in Indiana, and get vaccinated, we can suppress it, so eventually it becomes a mild illness, or better yet, an annoyance.
Mary, before we let you go, we're seeing this surge in cases and hospitalizations. Did Dr. Doering say anything about how masking people, even those who are vaccinated, will help hospitals?
Well, we're seeing there's an approximation about 200,000 cases could be coming forward in hospitals around the country per day. This is going to be a big burden on the healthcare system.
Right.
And yes, we did speak about that. Masking could prevent that.
Good. Okay, well, there you go. Mary, thank you.
Thank you, Phil.
Meanwhile, promising news from Pfizer. Its booster shot likely provides the highest level of protection against COVID-19, especially the Delta variant. New data shows that people between 18 and 55 years old who got the third shot had 5 times the antibody levels. Those levels are 11 times higher for 65 to 85-year-olds. Pfizer says that it will apply for emergency use authorization for that booster shot soon. Today, the U.S. Surgeon General says Americans should not seek a third shot on their own and instead wait until it's approved.